So women and men are different, that's no surprise, but just how different is the focus of a little-known research center here in Aurora. It's called the Center for Women's Health Research, and as producer Jenny Castor shows us, they're finding a need to diagnose, treat, and care for women differently than our male counterparts.
Walking, running, biking. Many of us are active here in Colorado, but for the growing number of Americans diagnosed with type 2 diabetes, there may be previously unknown conditions that make physical activity more difficult.
We're looking at how people with diabetes come to have an exercise impairment.
And that's even more likely if you're a woman.
Ultimately, that could mean you aren't able to carry out normal activities and live an independent life.
On the Anschutz Medical Campus, Dr. Judy Regensteiner and her team are busy taking heart health research and the connection to diabetes beyond diet and the kitchen and onto the treadmill.
I study diabetes and sex differences in the impairment in exercise capacity because we want to make sure that people don't lose functional capacity as they get older, and also because we want to prevent heart disease in adults with type 2 diabetes.
Colleague Shauna is helping Dr. Regensteiner demonstrate how a participant's vital signs are monitored to gather the best data.
We're monitoring her EKG, which is the electrical activity of her heart. Most importantly, we look to see how people are feeling during exercise.
The data gathered here will lead to increased understanding of how diabetes affects the heart and will give doctors better treatment options for their female patients.
Our goal is to make life better for women, their families, and the community in general.
It's about finding answers to give women the tools to stop the cycle of disease for themselves and their families.
We're in the wake-up stage for the community, I think, for people to actually understand and appreciate that really it wasn't until just 20 years ago that women were included in medical research.
Until recently, most testing had been done on male participants, and the medical community didn't believe there was really a big difference between the sexes, other than the obvious. That's no longer the case.
A lot of people don't realize that the way, for instance, the symptoms of heart attacks in women and men can be different. And the drugs people take between women and men can be different.
These are our mothers, these are our wives, our daughters, our granddaughters.
Managing Director David Sampson says that keeping young scientists active in women's health research is also part of the center's mission. Grants from here lead to much bigger opportunities.
Of the $380,000 that the Center for Women's Health Research has given in seed grants, that has leveraged over $27 million in bigger national grants for our young scientists.
And that can lead to cures.
Work that is being done here today will hopefully lead to cures for illnesses and disease that will be important for our children and our grandchildren and future generations.
For Aurora News Weekly, I'm Jenny Castor.
There are several studies taking place right now at the Center for Women's Health Research, and they need your help. They're calling all women and some men too, both with and without type 2 diabetes. They need 30 more participants for current studies. Visit cwhr.org to learn how you can help.